Welcome back to AETV Live. This is Health Talk, and I am Ogaga Ekam. I'm your host. I've still got Dr. Chijindu Dewigwe, and we are considering the topic sickle cell anemia. She has told us what sickle cell anemia is, the types of sickle cell disease, because according to the doctor, sickle cell anemia is just one of the conditions under sickle cell disease. She has told us the causes and risk factors and complications. You mentioned quite a number of them, and you said stroke. So now you talked about blood vessels being blocked in the brain. So is that the only condition that stroke occurs, when a blood vessel is blocked in the brain? If a blood vessel is blocked outside the brain, can one not see experience stroke?
Well, when it occurs in the brain, that's when stroke occurs. When it occurs outside the brain, there are other issues that could cause. Like I mentioned, the same acute chest syndrome, the nephropathy, and all are blood vessels that are blocked outside the brain. So they are different they are different diseases or whatever. But when it occurs in the brain, that's when it's called stroke.
Okay, you talked about ulcer. So now, most times when you mention ulcer, at least in this part of it, one of the things that comes to the mind is stomach. So what really is this ulcer condition? Is it a condition where a wound and injury refuses to heal?
Yes, you got it right. Ulcer is a non-healing wound. Basically.
So it can occur anywhere in the stomach, gastric ulcer, and all of that.
Yes, it can occur anywhere.
Okay, so you talked about pain, one of the complications. Why? And you said it's almost consistent in most of the complications.
Yeah.
What's the cause of this pain?
The pain is basically caused by hypoxia. Hypoxia in the sense that area, because it's blocked, is not receiving enough oxygen. Remember, the function of the red blood cells is to carry oxygen to the various parts of the body. So at that point in time, there's a blockage. And so oxygen is not getting to that area. So the hypoxia basically means low oxygen, or reduced supply of oxygen. So that's what, there are also a lot of other metabolic pathways, which I'm not going to go into right now, that also mediates the pain that they are feeling. But chief amongst it is the hypoxia.
Now, let's talk about the symptoms of sickle cell anemia. How can one tell that he or she is down with sickle cell anemia?
Okay. The first way, or rather, people who are intending to marry should actually check their genotype to know. But there are scenarios where they do not even know that they are both AS, or maybe one person is a sickle, or all of that. So the commonest symptom, that the children, maybe their children at about 1-2 years old, they start having swelling of their hands and feet, and pains in their fingers and toes, and then they come to the hospital, and then that's one of the crises that they usually have. They call it hand and foot syndrome.
Okay.
So that's the commonest presentation that they have. So, and it usually occurs maybe around 2-3 years old. And why it occurs then is because as children, there are different variants of the hemoglobin, which I don't want to go into also. It's quite molecular, but it's the commonest, the fetal hemoglobin. So the fetal hemoglobin somewhat confers some level of protection on the children. So they do not have the presenting complaints early enough.
So the fetal hemoglobin, do they die away?
As a child grows, they change from the fetal to the adult hemoglobin. Okay. So the fetal hemoglobin is more, is more sturdy than the adult hemoglobin, so it can withstand stress. The stress of all those.
Interesting.
So the fetal hemoglobin is protective of children. So when they are getting towards 2-3 years old, that's when the metamorphosis has started from the fetal to the adult hemoglobin, and then the signs and symptoms now begin to get exposed in the children. Yes, chief. So the commonest, which is the hand and foot syndrome at that age. Okay,
so now when children are born, when we have new children and all of that, do the doctors, the hospitals, do they carry out the genotype test to ascertain?
Yes, they do. In the olden days, there were a lot of underreported cases of sickle cell anemia. Okay. Commoner in the East. I'm from the East, and there's something we used to call obanje. When you give birth to a child, a woman has given birth to children that keep dying and dying and dying, and then say, oh, the child is an obanje, he dies and reincarnates and all of that. So studies have shown that this woman and her husband are possibly AS, and she kept giving birth to children who kept dying because they were sicklers at that age, because there were not adequate interventions to take place. So with increase in knowledge, increase in technology and all that, every child who's born in the hospital, a genotype test is actually conducted for the child, because the earlier you know, the better for you. It also helps to prepare you for the worst.
Okay, just for context, she's from the eastern part of Nigeria. Yeah, that's what she was referring to. So the major symptom, because that's the only one you mentioned, the hand and feet, the hand and foot syndrome, which is the swelling and all of that.
Yes, for the child.
For the child.
At that age. There are other symptoms.
Okay, what other symptoms for adults as well?
Okay, so for adults, they could have excruciating pains. An adult come, an adult, now maybe I'm referring to a preteen or a teenager, could come and tell you, I'm having excruciating pains in my hand, and is crying like a baby. You know, so this is as a result of, like I said, the blood cells trying to pass through, you know, but because it's not passing through, it's causing so much pain, and then hypoxia also ongoing. So they could have pain. It could be in the hand. It mostly occurs in the long bones, so maybe in the thigh bones, in the bones in the hands. You know, they come with so much pain. Also, another thing, they are also they fall. You know why they say they fall sick easily? Because their immunity is not optimal. You know, so they keep falling sick, maybe malaria, pneumonia. So this person that is always coming to the hospital, this infection, it now leads us to, okay, let us just conduct a genotype test for this child, because nobody should be falling sick this often. Maybe in a month, you've fallen sick like 6 times. You're certainly not the only person that lives on earth. You understand? So that's also a presenting cup. Also, another one, you notice that this person keeps getting pale, you know, maybe his eyes are white or his hands are, he keeps getting pale, his blood level keeps reducing, you keep needing to do a blood transfusion every time. That's the anemia. That's actually what anemia means, reduced blood in the body. Like, yes, kind of. So you keep needing to do a blood transfusion. It's also a trigger point. Okay, let me do genotype of this child and see what or of these adults now, or whatever age person is presenting at, you know, so that let me know what exactly is wrong. You know, that's also another symptom that they have. Okay,
you mentioned that it majorly affects the long bones in the body. Is there a medical reason behind this?
Because the long bones is where the bone marrow, where the blood cells are formed, is in the long bones.
Okay.
So yes, that is basically the principle behind it.
All right. So how is sickle cell anemia diagnosed?
Wow. Well, the first thing, or the first way to diagnose this, is to do a simple genotype test. So when the child is born, or whenever the child presents, you do a genotype test. So there has been cases, or there have been cases of misdiagnosis in children, adults. You know, someone grew up and tell you, oh, I did my genotype test 25 years ago, and they told me I was AA, and then now you're telling me I'm AS.
Yes.
So the routine genotype test that is done, you know, it's human beings that are conducting it. You know, in the lab scientists do, you know, it's a mix of colors, and then, you know, so there's also the error. Someone maybe at that point in time may not be seeing it clearly, or, you know, there are several factors, so there could be an error. So there's been a lot of error associated with that particular method, the simple genotype test that is done in the lab. So there's a more advanced method. We call it the HPLC, high performance liquid chromatography. You know, it's a machine that does it, and then it has much more accuracy than that of the simple one that is done in the lab. And also, when people come and tell you, oh, I'm AA, but my parents told me I was AS or whatever, we also say, please just go do a HPLC so that you can be 100% certain that your genotype is correct. Yes.
Okay, so the HPLC reduces the error margin.
Exactly, yes.
Okay, so just these two, these are the major genotype tests and HPLC. Now, before we consider the prevention and treatment, I think this is a good place to end it. Thank you for your time.